The characteristic is to preserve the ovaries and uterus and to remove the tumors in young patients who wish to preserve their fertility. So we have now 6 different ways to preserve this fertility, with simple cone resection to radical surgery with parametrial removal. This is so-called radical trachelectomy. And we have 4 different approaches to use radical trachelectomy, and the last one is the use of neoadjuvant. All these patients need to be node-negative with an early stage, meaning a tumor size below 4 to 5 centimeters without any spread of the disease. So it is indicated in early stage disease. The results, you have 2 views. The first one is oncologic results, and the question is, does the safety of this fertility-sparing surgery is similar to patients treated radically? This is the first step, and the second step is the fertility issues and outcomes on fertility issues. About the safety, in patients with very small tumors, smaller than 2 centimeters, there is a safety issue demonstrated to use this radical trachelectomy or simple cone resection in patients without nodal involvement. In patients between 2 and 4 centimeters, we need to evaluate the safety between radical trachelectomy by abdominal approach, meaning opening the abdomen, or using laparoscopic surgery, or neoadjuvant chemo plus conservative surgery. This needs to be evaluated. About fertility issues, in patients with very small tumor size treated with simple cone resection, the fertility issues are good. In patients with bulky tumors between 2 and 4 centimeters, meaning stage 1B2 in new figure classification staging, we need to evaluate, but it seems that fertility results are better in the patient treated with neoadjuvant following conservative approach instead of radical trachelectomy by abdominal surgery. You need to be trained to all the kind of surgery. If you have 6 different approaches, you need to be trained to do this surgery. But as in real life, it's not possible. You need to raise the question of the centralization of care in selected centers who use this combination of different treatments. And it's also important because one of the crucial steps before to do that is the histologic criteria. What is the size of the tumor, the histotypes, if there are lymphovascular space involvement. In this way, there is a good logical way to centralize these few cases of fertility-sparing surgery in reference centers at the scale of countries, because we have very few cases at the scale of countries, and not to treat all these few cases in all the centers, because we will do some mistakes.